Hi, how's it going? My name is Jack Kirshner, and today I'm going to be talking to you about LSD induced psychosis. So, what is LSD? So, the full name of LSD is lysergic acid diethylamide. It's a very strong hallucinogenic and is usually measured in micrograms, characterized by the symbol UG. It interacts with serotonin receptors in your brain. It gets stuck and needs to be reabsorbed. So the mechanism of action behind that is when you take your acid or LSD or what have you, and you put that on your tongue, it will be absorbed over a period of time into your body until it gets absorbed and then eventually gets to your brain. At that point in time, the serotonin receptor then will react this with the LSD that you've inserted, through your body through the medication you've taken, and it'll get stuck into that receptor and it'll just keep firing over and over again until that's reabsorbed because of the shape of the LSD. It fits into the receptor, but it fits in there in such a way that it just gets stuck and it needs for the brain to reabsorb it. That's why the intensity can last for about 12 plus hours, varying on the individual and their rate of the reabsorption of that LSD. So taking LSD or tripping can cause short-term psychosis or a loss of understanding of reality. That can be like perceived through like delusions, um, psychological addiction, psychosis, flashbacks, depressions. You can see in this little photo here has a list of the effects that LSD can have on you. Yeah, the psychological effects are pretty bad especially if you look towards like the paranoia, hallucinogens, and sensory distortion. This is what's going to lead you to getting the LSD-induced psychotic disorder. It can also cause schizophrenia if you have a predisposition for it. However, if you don't have that predisposition, you're not at any higher risk of developing schizophrenia compared to anybody else. It's only if you have that disposition for it, predisposition. So the types of hallucinogens you can have are tactile hallucinogens, olfactory, auditory, gustorial, and visual. Yeah, LSD will affect like all of the hallucinations of all of your senses. So it can really put you in a true state of just distorted reality where all of your senses just aren't aligning with what's happening in reality, and it just can cause, like we were talking about earlier with that short-term psychosis induced by LSD. So we have good trips and we have bad trips. Excuse me. So good trips are usually deep, insightful, and happy. Usually, you feel that the world is very beautiful. Along with those good trips, you also have the possibility to have a bad trip, which is usually perceived as being fearful, anxiety. In severe cases, can lead to suicidal thoughts or actions, which result from bad hallucinations. Taking too big of a dose too can also impact how you're going to trip, because obviously the more LSD you consume, like the more you're going to trip. So if you reach a certain point where like your body just cannot handle that amount of LSD, like you're just going to get to a point where you're just having a bad trip, and all of your understanding of like reality will just be distorted to a point where you just have no idea what's going on. So for treatment wise, there's not a whole lot you can do if it's not going to be for long-term issues. Just for short-term wise, it's going to be out of your system roughly 12 to 14 hours, so an observable space to allow for that detox period to occur. Usually it can be done in a hospital or around like a safe, trusted friend or ally. But yeah, in the hospital, if they're being too active and too riled up, you can give them a sedative medication just to help them relax and try to keep their trip under control until it passes. For long-term problems that develop due to taking LSD, you recommend antipsychotic medications and psychotherapy. These are my sources. I hope you enjoyed my presentation on LSD-induced psychosis, and I hope you learned something today. Thank you.